Welcome back to Session 7. In this session, we explore the intersection of trauma disorders, brain functioning, as well as our metabolic health. Please know that this video may contain material that is triggering for those of us who have suffered traumatic events and stressors. If you feel uncomfortable at any time, please stop and take a break. If you have a safe friend, family member, or counselor, don't hesitate to reach out. Let them know you're having a rough day and that it would be helpful to discuss your thoughts and feelings. If no one is available for a mental health crisis, you can call or text 988, the Suicide and Crisis Lifeline, for immediate free support, or call 911 for life-threatening emergencies. Make sure to tell the dispatcher it's a mental health situation and asking for Crisis Intervention Team (CIT) members if available. 911 handles immediate dangers, while 988 connects you to mental health counselors 24/7. Here you can review the topics that we'll cover in this session. Please see the course guide for more information and links to all the research references.
In earlier sessions, we learned that chronic stress and unrelenting anxiety can lead to the development of metabolic disorder and other serious illnesses. Post-traumatic stress disorder, PTSD, panic disorder, and other trauma-related conditions present an even higher risk for elevated and severe stress responses. Negative experiences, whether acute or chronic, can modify the HPA, the processing of emotions in the amygdala, as well as how memories are stored in the hippocampus. These consequences lead to many of the dysregulated eating behaviors we've discussed in earlier sessions. It makes sense then that PTSD severity is associated with an increased risk of metabolic disorders. This includes diabetes, cardiovascular disease, and excessive weight gain. When clients are suffering with chronic stress, it's difficult, if not nearly impossible, to lose weight. Even after they establish healthy lifestyle practices, weight loss may suddenly plateau. If there are no other explanations, clients may need to identify, eliminate, or reduce the frequency of exposure to intense stressors.
Before we begin this module, we open with having clients recall and visualize a moment of pure contentment as presented here. This moment may be a day you spent at the beach listening to waves and feeling warm, a slow walk through a fern-filled forest, or watching herons fly over the stillness of low country marsh. Close your eyes and with all your senses remember the details of your moment. If at any point in this session you feel stressed, stop. Go to that place in your mind and return to this session when you're ready. Combined with a few deep and steady breaths, this form of visual and experiential recall is one of the most powerful and readily available techniques we can use to counter feelings of tension and anxiety. There are images and topics in this session that may be triggering. Stop at any time and take a break. The memories or images that may cause us to feel discomfort are also opportunities to explore and understand our preferences, fears, and past experience.
Trauma-related disorders range across a spectrum of severity and include disorders in which there has been exposure to a trauma or stressful event. It's a misconception, however, that trauma injury to the mind, body, and spirit comes only to those individuals who have experienced threats of death, sexual violence, or serious injury. The widespread disruption, anxiety, and stress left by the wake of the pandemic and world events, as well as unemployment, poverty, and the impacts of racism, have shown us that this is not the case. Trauma is universal. The experience and legacy of trauma is unique to each individual. However, exposure to trauma can affect anyone of any age at any time.
Over the past 30 years, studies on adverse childhood experiences, ACEs, have shown us the long-term damage that trauma can do. The CDC Kaiser AC study revealed that 61% of U.S. adults had experienced one or more types of significant abuse or adverse events during their childhood, and that the number of event exposures correlates with increased incidence of adult chronic illness. In another study, U.S. adults who had experienced 4 or more categories of ACEs were found to have 12 times the rate of PTSD, alcoholism, drug abuse, depression, and suicide than was observed among members of the general U.S. population.
Recent studies indicate that the consequences of trauma can also be transmitted from generation to generation through modifications in the DNA of the exposed individual that alter the function of one or more genes. For example, in the offspring of Holocaust survivors, changes to the FK506 binding protein 51 gene, an important modulator of glucocorticoids and the HPA, have been found. These changes can have direct stress-related correlations with the onset and development of mental and metabolic health conditions. If not addressed and identified accurately, depression, anxiety, and substance use can be outward manifestations of trauma, moral injury, and unresolved grief.
In clinical studies, it's been well documented that childhood abuse often precedes the onset of weight gain and metabolic problems. In the narratives of some participants who suffered physical and sexual abuse, it's important to recognize that weight gain may have been viewed differently at the time of trauma. Gaining weight to be physically intimidating or less attractive was sometimes seen as the protective solution and not seen as a problem. In the narrative of a team member's lived experience,
"After my father raped me, I never wanted to be seen as a pretty girl again. To cope, I tried my best to dress and act like a boy through my teen years, but this just made me a laughable outcast. If someone touched me or tried to compliment me, I felt nothing but panic, overwhelming shame, and a desire to flee."
The DSM-5 published by the American Psychiatric Association includes several categories of trauma-related disorders, including specific criteria for reactive attachment disorder, adjustment disorder, acute stress disorder, and post-traumatic stress disorder, PTSD.
in general, after experiencing trauma, PTSD can be identified by the following: recurrent, involuntary, distressing memories, disturbing dreams, intense reactions, flashbacks, and distress when reminded of the trauma, avoiding or pushing away memories, thoughts, or feelings related to the circumstances, including reminders such as people or places, ongoing negative beliefs about oneself or others leading to self-blame, negative emotions like fear, horror, guilt, and shame, less interest in activities and feeling disconnected from others, struggling to feel positive emotions like happiness, love, joy, or satisfaction, irritable behavior and angry outbursts that may result in reckless or self-destructive actions, being constantly on edge and easily startled, difficulty concentrating, and lastly, trouble falling or staying asleep. There are a lot of similarities shared by PTSD, anxiety, and depressive disorders. From an inclusive perspective, these can include
The pervasive sense that we're not okay. A deep-seated fear that we'll never be the same or never be happy again.
The fear that other relationships or situations will never heal or recover.
Thoughts of being bad or undesirable because of things that have happened.
Feeling detached, lonely, sad, and misunderstood by others.
Feeling afraid no one will like us if they knew what we've experienced.
shame associated with trauma can keep clients paralyzed for years, even decades, but recovery is possible.
Compared with the general population, people with PTSD have an almost double increased risk for metabolic syndrome, as well as a higher mortality rate from cardiovascular disease. As more studies emerge, researchers have suggested that PTSD may be a metabolic disorder in disguise, increasing the risk of conditions such as obesity, dyslipidemia, and hypertension, as well as type 2 diabetes.
PTSD involves failure to reinstate physiological homeostasis after traumatic events and is due to intrinsic or trauma-related alterations in physiological systems across the body. Homeostasis in this context refers to self-regulating processes that return critical systems of the body to a set point within a narrow range of operation, consistent with optimal functioning, survival, and longevity. Master homeostatic regulators that circulate and operate throughout the body include stress hormones, as well as immune mediators such as cytokines. Patients with PTSD are more likely to have hyperglycemia, hypertriglyceridemia, high levels of LDL cholesterol, and high blood pressure. With respect to eating behaviors, trauma disorders share many of the same physiological, cognitive, and emotional triggers that have been discussed in previous sessions. Namely, negative effects from stress, sleep disturbances, food choices, lifestyle habits, and diminished physical activity. Metabolic dysregulation and chronically elevated glucose concentration, as seen with PTSD, damaged mitochondria and mitochondrial DNA, generating byproducts that promote systemic inflammation, insulin resistance, oxidative stress, altered gene expression, and accelerated cellular aging. The level of metabolic dysfunction increases with severity of PTSD symptoms. While it's normal for the risk for metabolic conditions to increase with age, research shows that even younger people with PTSD are more likely to have metabolic health issues that reflect advanced cellular aging than would be expected for their chronological age. Numerous clinical protocols have been developed for the treatment of PTSD. The challenge for advocating for or selecting the use of one approach over others, as well as integrated approaches, is the lack of meta-analyses that systematically compare symptom remission or recovery and the generalizability of findings to subgroups based on gender and sexual identity, race, ethnicity, age, and other patient characteristics. Since 2004, the VA Evidence-Based Practice Group has routinely evaluated treatment protocols for PTSD to improve patient health and well-being. The trauma-focused psychotherapies with the strongest evidence from clinical trials are prolonged exposure therapy, cognitive processing therapy, and EMDR, eye movement desensitization and reprocessing. The VA/DoD 2023 guidelines presently recommend treating PTSD using individual trauma-focused psychotherapy over medications, as research to date indicates that these therapies lead to greater and lasting improvement in symptoms. Studies also indicate that virtual video therapy has been shown to be as effective as in-person therapy.
When individual trauma counseling is unavailable, specialized closed trauma recovery groups can be a safe and powerful venue for healing and building social support. These groups allow participants to safely share experiences and gain the encouragement they may need to engage in positive lifestyle changes that support their health and recovery.
Injuries or illnesses that result from trauma significantly affect homeostasis in both the body and brain. Integrating lifestyle education from local licensed providers that focuses on anti-inflammatory nutrition, as well as discussing rest and adequate sleep, stress reduction, and avoiding risky substances, can be key to restoring the body-brain balance and speed the healing process.
It's normal for mixed features of depression and anxiety to be present with a diagnosis of PTSD. That said, individuals with PTSD differ from those with other disorders in that with little provocation, they may be more likely to respond with anger or aggressiveness and engage in reckless or self-destructive behaviors. This is because memories from past trauma can reside within both the mind and body.
Adults with a history of childhood maltreatment are more likely to experience distrust, feel distant from others, and react explosively when challenged or confronted. This is because early trauma can disrupt normal development of social homeostasis deep within the HPA. This disruption increases hypervigilance and contributes to the onset of emotional and neurodevelopmental processing disorders. When fear is pervasive, this can naturally lead to the development of insecure attachment styles and behaviors. These types of behaviors serve as a protective mechanism to avoid social or interpersonal distress. That said, for those with mental health disorders, social isolation can further decrease dopamine and oxytocin activity in the brain, intensifying features of both depression and anxiety. Because a trauma experience is emotionally and physiologically overwhelming, it's been suggested that the body stores the memories, thoughts, and emotions of the trauma to process them at a later date. Trauma causes very deep muscle contraction designed to protect the body from harm or possible death during a traumatic episode. Once the trauma is over, the body's nervous system is designed to literally shake out this deep muscular tension and help the body return to its normal state. This shaking or tremoring, evoked by the nervous system, signals the brain to release the muscle contraction and return to a normal state of relaxation. For some, this shaking mechanism may no longer function to reduce muscular tension after the trauma is over. The high chemical charge left in the body after trauma continually seeks to discharge. When that discharge does not occur, the brain translates this excessive charge into intense emotions such as hatred, rage, and shame, or other destructive and sometimes vengeful expressions of pain. Some course participants have found tension relief through practicing tension and trauma release exercises. These exercises are designed to release tension to restore the body back to its relaxed state and prevent the development of physical pain and constrictions.
It's clear from both the psychological and physiological perspectives that we're extremely vulnerable to environmental influences in our early years. This is particularly relevant when we consider the development of the central pathways that govern mood, metabolism, and feeding behaviors. Even in utero, excessive stress, poor nutrition, and periods of famine can have long-lasting consequences, resulting in higher levels of inflammatory biomarkers such as interleukin-6, cytokines, and C-reactive protein. Increased susceptibility to mood disorders, impaired learning and memory problems, as well as sensory changes and triggers involving smell, sound, touch, and noise. There are also changes to reward pathways resulting in higher incidence rates of disordered eating and problems with addiction.
Abnormal reward-seeking and maintenance behaviors are innate in the PTSD diagnosis. Risky behaviors often surface for those with PTSD and sometimes tie directly to the severity of symptoms. Activities and substances that boost dopamine, like sugar, alcohol, nicotine, and opioids, can become self-reinforcing. Reflect for a minute on what we learned about the brain in sessions 2 and 3. Low dopamine activity, compounded by low serotonin levels, can prompt us to act impulsively or seek activities that we know will upregulate dopamine.
At any stage of life, trauma can result in permanent biological and neurological changes to brain chemistry and functioning of the limbic system. In order for our brain and bodies to recover from responses to fearful or threatening events, a critical factor in the amygdala is normal regulation of gamma-aminobutyric acid, GABA neurons. You may have heard of GABA being prescribed for the treatment of different disorders. GABA is an important neurotransmitter in the central nervous system, which can calm neural activity and prevent nerve cells from overheating. GABA is present at approximately 1/3 of all synapses in the central nervous system and plays an essential role in regulating the stress response, emotion, registration, and encoding of fear memory. After traumatic events, the normal GABA balancing mechanisms necessary for emotional control between neural networks may be impaired, making it difficult to return to homeostasis.
Brain studies of individuals with PTSD show patterns of excess GABA and decreased cerebral blood flow. The excess GABA, originating from the enzyme MAO-B in astrocytes, disrupts fear regulation in the medial prefrontal cortex and the brain's ability to extinguish the response to traumatic memories. Natural ways to support the synthesis of GABA are through healthy eating, practicing relaxation techniques, engaging in regular physical activity, and, of course, restorative sleep.
With repeated activation of the fight or flight response, intense emotional responses may become the default reaction to any perceived threat or danger. This reaction can occur as a result of someone's tone of voice, gestures, teasing, touch, and more. Anything that is triggering to the senses, a photograph, a certain smell, a sound, or being surprised, can result in neurochemical flooding and surges of energy even in the absence of an actual threat. For example, if parental alcoholism was a factor in the onset of CPTSD, it's likely that even decades later, the smell of alcohol on another person's breath will instantaneously trigger repulsive, unpleasant memories and physiological responses.
It's fair to say that in active PTSD, the HPA, Brian, is overwhelmed and exhausted from sustained hypervigilance and trying to compensate in the aftermath of chemical explosions. Without help in overriding emotional Betty, Brian can't begin his cleanup efforts to regulate our bodies and restore normal functioning. When the brain is out of balance, much like those with attention deficit disorders, information may not be interpreted, processed, or stored efficiently, making recall challenging. For these reasons, it's understandable why individuals who are subjected to trauma may at times feel dissociated from their body and disconnected from everyday life. They may experience loss of memory, blocked memories, feeling numb, or a driving need to just want to feel something.
For those growing up with complex PTSD, emotional memories may not be stored correctly in the hippocampus. This can leave gaps in knowledge and memory that can perpetuate chronic and confusing feelings of shame. They may think they're supposed to know or feel things that they simply never learned. Sometimes, due to feelings of shame, inferiority, or other fears, they may be forced to observe others and learn to mimic or mirror their responses. If they had to do this consistently, it's likely that at times they felt like a chameleon, constantly changing or adjusting expressions, appearance, or behaviors to try and blend in as best as possible. Carl was a BreakThrough course participant who, not unlike Jamie, had survived life-threatening events resulting in severe exposure and hypothermia. For this client, normal living was manageable for decades, but in times of stress, he suffered with recurring cycles of dysregulated eating behaviors. He came to see us after an incident where he had to run into extremely cold water to grasp a young child. The original trauma responses had fully reactivated, his anxiety was unrelenting, and he'd slipped back into a compensating pattern of binge eating. Having recovered from alcohol abuse in his 20s, Carl did not want to take prescription medication, preferring to try other approaches to healing. It took several weeks of intense, 3 visits per week, trauma-focused therapy before the physiological shock response went significantly into remission, and he asked to join one of the BreakThrough groups. To help Carl reassure his brain that everything was okay, we developed several resistance statements.
I'm safe. I just feel cold, or I'm just cold. I'm not dying.
With these statements, we were harnessing the power of the frontal cortex to retrain and diminish the trauma response generated by the amygdala. Talk therapy was helpful to reduce the emotional and physiological intensity of feeling cold-soaked and helpless. That said, significant physiological gains were made possible by integrating other care practices that included physical therapy at an old injury site, massage, warm immersive soaking, the use of essential oils, and relaxing binaural meditation music.
Carl's early struggles with abusing alcohol and the later onset of binge eating are not uncommon behaviors in recovery from trauma disorders. Individuals struggling to recover from PTSD, moral injury, and other disorders are vulnerable to impulsiveness and stimulus-driven behaviors. The strength of the emotional response to stimuli rests on perception, an instantaneous process of attention, evaluation, and judgment. Experience, assimilation, and recall are among the factors that determine the reinforcing value, positive or negative, of a stimulus. In identifying differences between implicit, immediate emotional, versus explicit, long-term rational influences in decision-making, Rolls suggests that internal conflict arises when the implicit system guides behavior toward immediate reinforcement that undermines or defers explicit long-term benefits or goals. We know that targeted marketing of food or dining experiences is intended to overcome the best of intentions. It's not always about fast food, though. Sometimes the attraction is perceived value such as all-you-can-eat lobster fest or buy one, take 3 home for free. Either way, the result is likely to be overconsumption or too many kittens. As the course progresses, we focus on the breakthrough 4 R's of cognitive restructuring: recognition, resistance, resilience, and recovery. A solid body of research for the treatment of PTSD focuses on the importance of developing or regaining resilience in recovery from trauma. In 2023, an NIH working group published a special volume discussing resilience across domains as well as guidance for future research, It suggested that resilience is commonly thought of as the ability to recover from, or adjust easily to, a misfortune or change that can refer to a community's or individual's capacity to maintain adequate function and structure after being subjected to specific challenges.
To recover resilience, it's likely that focusing on needs rather than wants will help the transition from stimulus-based reaction to goal-oriented control. When faced with temptations, we keep the brain statement simple.
I may want this, but I don't need this.
It's been proposed that psychosocial resilience should focus less on an individual's weaknesses or deficits in the face of adversity, and more on the strengths and resources that enable an individual to grow and thrive when exposed to seemingly overwhelming challenges. This suggests that helping clients develop their strength-based narrative and schema is a critical component in working toward building effective and cognitive resilience.
We've discussed the executive top-down frontal cortex approach to exercising control over thoughts, emotions, and behaviors. Often we remind participants that we either exert goal-oriented control of our thoughts and behaviors or we're along for the ride. Harnessing the executive functions in the frontal cortex is what's needed to retrain reactions to triggers or cues that provoke trauma-related fight, flight, or freeze responses. In session, we discuss this approach for taking control.
First, we need to slow down. Second, we evaluate what's happening in the present context. Is this real? Or what's really happening? Third, we remind and reassure ourselves that we're safe, we're okay, and nothing bad is happening right now.
By slowing down, the HPA and central nervous system have time to stabilize and determine actual needs to regain homeostasis. If negative emotions start to rush in, we remind clients to take a moment to calm Betty, recognizing and appreciating the safety alert. As the energy dissipates, that's when it's possible to evaluate and challenge old responses and actions. Sometimes slowing down isn't enough. In times like these, when possible, we need to identify what happened and follow up with some kind of corrective action. Goal-directed action that increases effectiveness does not depend on environmental or external factors, rather. It's planned and orchestrated. In this session, we want to begin to shift our attention toward reframing thought patterns and building up a reserve of goal-oriented thoughts. Some of these skills may be recognizing our mood and deliberately diverting our attention. Suggestions include listening to or playing music, working on a hobby, taking a bath, or even going for a short walk. Some skills may be more complex and require concerted practice. Either way, we're working on regaining resilience through being present with ourselves and our surroundings.
Developing our strength-based narrative and schema is a critical component in building effective and cognitive resilience. Resilience is defined in GERT, a recent intervention designed for the treatment of PTSD, as a positive adaptation to stressors. To develop resilience, the authors emphasize the importance of shifting to voluntary, intentional, future-oriented, and goal-directed behavior. With PTSD, hypervigilance may persist. An unconscious yet pervasive scanning of situations for positive versus negative, reward versus punishment, safe versus dangerous. Ultimately, these rigid patterns can be challenged with a logical form of appraisal. The opposite of rigid or dichotomous thinking is cognitive flexibility. To develop cognitive flexibility as a skill, we may need to learn to slow down. To be willing to stop and take time and ask ourselves questions such as,
Do I have enough information to make a decision now?
We would be remiss if we didn't touch on historical trauma. The psychological effects of forced relocation, assimilation, and other traumas inflicted on Indigenous peoples linger today. The intergenerational grief from the historical trauma experienced by Indigenous peoples is passed from generation to generation. If not addressed and identified accurately, depression, anxiety, PTSD, and substance use can be outward manifestations of trauma and unresolved grief. Trauma can also leave offspring less able to deal with the stress they experience. Sadly, in marginalized communities, this inheritance is reflected in higher rates of mental health disorders, substance use, and suicide.
There are known factors that perpetuate generational as well as present-day trauma that will surface during sessions. Racial trauma, a form of race-based stress, refers to people of color and indigenous individuals' reactions to dangerous events and real or perceived experiences of racial discrimination. Such experiences may include threats of harm and injury, humiliating and shaming events, and witnessing racial discrimination toward other people of color. Although similar to post-traumatic stress disorder, racial trauma is unique in that it involves ongoing individual and collective injuries due to exposure and re-exposure to race-based stress. In the US and other countries, there is an enduring legacy of moral injury and psychological stressors. While exhaustive efforts within the helping professions try to address the effects of generational and current trauma within marginalized populations, Native Americans, Vietnam veterans, African Americans, Hispanic and Asians to name a few, it may be impractical to expect significant mental or metabolic health recovery within these populations when injurious stressors, discrimination, and persecution continue. The intersection of trauma and the onset of metabolic health syndrome is well understood, especially when we consider the conditions that lead to or exacerbate reward deficiency syndrome. Culture can profoundly affect the meaning that a child or family attributes to specific types of traumatic events such as sexual abuse, physical abuse, and suicide. Culture may also powerfully influence the ways in which children and their families respond to traumatic events, including the ways in which they experience and express distress, disclose personal information to others, exchange support, and seek help. A cultural group's experiences with historical trauma can also affect their responses to trauma and loss, their worldview, and their expectations regarding the self, others, and social institutions. Culture also strongly influences the rituals and other ways through which children and families grieve over and mourn their losses.
In Session 2, we discuss cycles and choice points. In recovery from trauma, we don't want to perpetuate the presence of bitter Betty, who stays mired in the muck of resentments, misery, and defeat. In group, we shared that if we've been attacked, whether it's once or more often, we've been victimized. Unfortunately, in the aftermath of trauma, it's easy to lose a positive sense of self and the hope that things will get better. We may feel as though we're damaged or deserve what happened, even though we had no control over what happened. If we remain in a one-down or victim mindset, we may start to feel like we're not on an equal footing with others. Recovery from trauma may require us to express grief, process loss, and be willing to transition through the experience of mourning. Too often, whether it's a result of upbringing or other reasons, we don't let ourselves grieve or recognize that it's okay to feel angry, hurt, or both.
Processing losses helps regain emotional clarity and stability, but it's not an easy journey. It's important we recognize that in the process of moving on, we don't have to accept the unacceptable. With recognition and empathy, we develop the clarity that bad things happened, and the understanding that past events aren't a reflection of our character or potential.
Trauma significantly affects metabolic health. When we review metabolic data related to the Hispanic population compared to other non-Hispanic populations, Hispanics in the US have higher obesity rates, dyslipidemia, elevated blood pressure, and a greater propensity toward glucose dysregulation. Conditions that contribute to the leading causes of premature death among Hispanics. From the mental health perspective, studies spanning several decades report that between 44%–74% of Hispanics have experienced persistent daily stressors that include the fear of racial profiling, having to prove one's identity, reluctance to seek help from providers, criminal arrest, being treated like a criminal, and deportation of a loved one. Future efforts that address mental and metabolic health recovery will have to consider the significant consequences and long-term, generational effects for populations exposed to prejudice, oppression, and persecution.
In 2019, it was reported that Hispanic children were 1.7 times more likely than non-Hispanic white children to be obese, and Hispanic adolescents were 50% more likely than their peers to be obese. It's likely these trends will continue for the foreseeable future. US. Born children of Hispanic and other immigrants are increasing living with the constant fear of a parent's deportation, coupled with the additive negative effects of living in an anti-immigrant climate. Knowing that in utero exposure to chronic stress and trauma leads to permanent changes in biological, psychological, physiological, and social development, even those not yet born will have a higher likelihood of inheriting or developing mental and metabolic illnesses.
Another form of ongoing minority trauma is that experienced by sexual minorities. Sexual minority individuals experience greater lifetime prevalence of post-traumatic stress disorder, PTSD, than heterosexual populations. Chronic PTSD spanning from events in early childhood is often interpersonal in nature, to include sexual violence, and trauma perpetuated by known assailants, often their family. This can disrupt major domains of child development, including attachment relationships, peer relationships, and emotional regulation, and can reduce children's level of functioning at home, at school, and in the community. The National Center for PTSD reports that LGBTQ+ people are at higher risk of developing PTSD, with prevalence estimates of up to 48% of LGB individuals and 42% of transgender and gender-diverse individuals meeting criteria for PTSD. These estimates are much higher than the general population prevalence of 4.7%. Unless we ask about any early childhood illnesses or surgeries, we may be unaware of trauma and other disorders, such as a 30% increased risk for ADHD that can result from pediatric medical traumatic stress, PMTS. PMTS is defined as a set of psychological and physiological responses of children and their families to pain, injury, serious illness, medical procedures, and invasive or frightening treatment experiences. Very few evidence-based psychotherapies exist specifically for traumatized infants, young children, and their caregivers. Within this context, psychological birth trauma and childbirth-related PTSD present a substantial disease burden, with childbirth-related PTSD affecting 6.6 million mothers and 1.7 million fathers worldwide. Childbirth-related PTSD has a substantial negative impact on those who give birth, fathers or co-parents, and potentially the whole family. In session, we present a structured approach to encourage participants to write their personal post-trauma narrative. For some of us, the pain of past events may have become fused with our identity and narrative of self. For survivors, it's no easy feat to separate the past from present. A collaborative, strengths-based approach is designed to help us reframe our experiences, focus on our inherent resilience and resources, and construct a healthier life story that acknowledges trauma without being defined by it. Gaining an internal sense of control is significant to recovery from moral injury and PTSD. That said, one of the challenges that can undermine recovery and a sense of control is cognitive dissonance. This psychological discomfort occurs when there are discordant thoughts and behaviors. For example, we want to focus on self-care, but routinely find ourselves purchasing and indulging in junk food. Dissonance maintains chronic stress, as well as the need to suppress thoughts and emotions, or engage in justification. Challenging dissonance can begin with just doing one thing differently. For example, if the opportunity presents to exercise, we exercise even if for a few minutes, rather than procrastinating or heading directly to distractions. Building consistency between our goals, values, and behaviors serves to reduce the paralyzing nature of dissonance and builds self-efficacy. When we feel overwhelmed, it helps to focus on 1 hour at a time, 1 day at a time. We acknowledge our pain while beginning the process of teasing apart what happened to us from who we are and how we see ourselves. This change in thinking takes practice and repetition, but we can learn to separate ourselves from involuntary and unpleasant reactions with the certainty and knowledge that this is now. The train the brain statement participants find helpful is,
That was then. This is now. Goal-directed action is psychological in nature and is motivated by the belief that if we put forth effort, we'll achieve what we set out to accomplish. As an executive function, goal-directed action is compromised and displaced in response to traumatic stress. In recovery from any setback, setting new goals brings renewed purpose to thoughts and activities. When developing with goals, we emphasize that they need to be realistic, measurable, and achievable.
Survivor's guilt is described as the manifestation of tension, distress, or solitude that is triggered by a celebration of life, references to the deceased, and expressions of sympathy. The experience is individualized, can be influenced by various factors, and is often tied to the emotions of responsibility or unfairness. Survivor's guilt can make recovery from traumatic events, the loss of loved ones, friends, or coworkers, extremely difficult. Many participants who survived events such as the September 11th terrorist attacks, school shootings, or recovered from COVID-19, but lost family or friends, share common questions and feelings.
why them? Why not me?
Could I have done more?
If only I could have... Or...
If I'd known, I would have...
Thoughts like these are natural when people survive adverse situations and others don't fare as well. There is a point, though, when we may have to recognize that at the time the event took place, we had no reason to think that the particular moment, hour, or day would be any different from the one before. That we absolutely can't change what happened. Intellectually, we may recognize this is true. However, the emotions and phases of mourning are unique to the individual. So why do we cycle back to these same questions and feelings? Sometimes it's simply because we may have dissociated or felt numb for so long following the event that we just want to feel something, and pain feels familiar. If we find this happening often, we may have to purposefully do something else. This might be engaging in activities that are soothing or designed to reduce stress. Being kind to ourselves and engaging in thought stopping and reframing is far more effective than replaying harsh inner thoughts. The inner critic is always looking for what's wrong. In this mindset, we're more likely to engage in relapse behaviors that feed Be-Itching Betty. Conversely, an inner coach helps us appreciate our potential and gently encourages mindful and deliberate choices. Instead of berating ourselves for what we might have done differently, we can ask and journal questions like,
What do I want to do differently?
How can I make a positive difference?
What can I do today that will help me reach one of my goals?
What would my bestie encourage me to do?
For today, how can I cherish and honor the best qualities of people I miss?
What do I want to teach others about myself today?
Many of us underestimate the impact of witnessing or being exposed unintentionally to the devastation left in the wake of natural disasters, famine, war, or acts of terror. Nothing prepared any of us for the new horrors, chaos, and uncertainty brought forth by a global pandemic, economic uncertainty, natural disasters, political and cultural unrest, and social isolation.
Moral injury is a complex phenomenon characterized by spiritual, psychological, and moral distress caused by actions or acts of omission inconsistent with an individual's moral and ethical values. It's nearly impossible in our modern world to disconnect from the visual images and narratives that document ongoing atrocities and overt persecution unfolding every day. What's so very different in the modern context of conflict is that the majority of casualties associated with war are not soldiers, but civilians simply going about the activities of daily life. When everything is changing drastically, finding a safe space where we can process our thoughts and emotions can provide relief from overwhelming feelings of despair and hopelessness.
We don't compartmentalize thoughts and emotions as well as we'd like to or think we do. Even if this approach seemed to work to recover from adversity, this defense mechanism seems to fail with maturity. Typically, when something is bothering us, our emotions slip out and start to affect all of our experiences and interactions. When we realize that something's bothering us, then it's time to test our thoughts for accuracy as well as relevance to the present. PTSD can have an extremely negative effect on how we see ourselves with regard to our self-efficacy and sense of control, and eventually, this can affect our motivation to do things. If we stop thinking that we're capable and competent, it's easy to slide into a state where we become dependent on others and lose sight of our strengths and abilities.
Regaining our internal sense of control is significant to recovery from PTSD. We've talked a lot about rewriting our story and our personal view of ourselves. When we've experienced trauma, sometimes we may feel powerless to stop the flood of feelings in the moment. This is because sometimes the pain can become fused with our identity and our story of self. It's no easy feat to separate the past from today, and in early recovery, we may just need to focus on 1 hour at a time, 1 day at a time. When we've processed triggers and developed coping strategies, then, in the lyrics of Carly Simon, I haven't got time for the pain. Let's make this our time for renewal and healing.
So, how do we heal and recover? What we do is to acknowledge the pain, but then start to separate what happened to us from who we are and how we see ourselves. We are our strengths. We're not broken or damaged goods that should be mistreated or discarded. We'll want to focus our daily reflections on building and maintaining our new strength-based narrative. Unpleasant and disturbing emotions may surface in response to triggers. However, even if we initially respond from a place of fear, we can train our brain to appreciate and accept the emotions as protective neurochemical responses and nothing more. This change in thinking takes practice and repetition, but we can learn to separate ourselves from these involuntary and unpleasant reactions with the certainty and knowledge that this is now. Our train the brain statement. That was then, this is now. We're writing and living our new story.
Goal-directed action is psychological in nature and is motivated by the belief that if we put forth effort, we'll achieve what we set out to accomplish. It's true that goal-directed action, as an executive function, is compromised and displaced in response to traumatic stress. In recovery from any setback, setting new goals brings renewed purpose to our thoughts and activities. Whenever we set goals, they need to be realistic, measurable, and achievable. For example, if we want to lose 5 pounds, we can be realistic. 5 pounds is approximately 15,000 calories. If we eat an average of 2,000 calories a day and eat 250 calories less every day, then all things equal, it will take 60 days to lose 5 pounds. This is realistic, measurable, and achievable.
Safety is our primary goal in treating trauma, and this begins when we find or identify safe and supportive people we can talk to and trust with our stuff. Next up is recognizing and processing our trauma symptoms. These may include flashbacks, nightmares, as well as negative feelings. It's tough, but processing and then learning to cope and manage stressors without resorting to unhealthy food, risky substances, or engaging in self-destructive acts is the path to regaining our resilience. We feel better when we know we're taking good care of ourselves. We can start by scheduling regular wellness visits and adopting lifestyle changes that help us move towards specific goals. For some of us, safety means freeing ourselves from domestic violence or abusive relationships and finding new ways to feel good about ourselves, connect with others, and enjoy our lives. If we grew up in an environment marked by instability or abuse, that was the model we had for learning about relationships. Even if we promised ourselves,
When I grow up, I'll never put up with this snip.
after leaving home, however, we may unwittingly enter relationships that mimic the dynamics of the original abandonment or abuse. This subconscious attraction and pattern of behavior makes sense. Our psyche naturally seeks out opportunities to overcome and heal from the original psychic trauma. However, the reality of perpetuating these patterns may simply be reinforcing feelings of hopelessness, unworthiness, desperation, or shame. The signal for help that you see here is universal. It's posted in public places to help people escape human trafficking and other dangerous situations. If you see anyone using these signals, don't hesitate to alert authorities.
Carol was in her late 30s when we met her. She was struggling with the end of an abusive marriage and another relationship marked by betrayal. She was in recovery from anorexia and experiencing severe depression. There was no question Carol was suffering with complex PTSD and very early in her recovery. To understand why she felt stuck, we explored her family history and events that spanned several decades. Her story may trigger unpleasant memories for those in recovery from sexual assault or domestic abuse. It's perfectly okay to skip ahead about 8 minutes if you feel it's a better choice for where you're at in your journey right now. This is her narrative.
My parents should never have had a child. My mother let me know early on that I was a mistake. She never wanted a child and would tell me that I ruined her life and career. Later, one of my uncles told me that no one ever saw her during the pregnancy and everyone had expected her to terminate the pregnancy. She was physically, mentally, and emotionally abusive, controlling, rigid, and manipulative until the day she passed. My memories of childhood are of punishment, screaming, fear, and tears. With few exceptions, the bruises, burns, and lacerations were left in places people wouldn't see them. My dad was out of the picture for a while, but he came back. He was abusive, but this was different. At first, he was overly affectionate. He would cuddle, tickle, and play touching games. At one point when I was 10, he pulled out his private so he could show me and tell me how much I turned him on. I was terrified and the darkness took hold. Sometime when I was 12, my mother was away on a business trip, and he came to me in an alcoholic blackout late one night. I tried to talk to my mom when she returned, but she accused me of lying and nothing changed. Eventually, I was sent away to live with friends, and in no time their older teenage son picked up where my dad left off. I had no one to turn to. Their son left home for college, but within the week, I was targeted by one of his classmates. When I look back, I don't remember the threats that kept me quiet, but I graduated high school with honors and went to college out of state. College was freedom. I got good grades, I had great roommates, and for the first time ever I was happy and I felt safe. In my last year of college, I met John. He was charming, ambitious, well-educated, and came from a close-knit family. Within the year, we were engaged and married. At first, everything seemed to be going our way. He landed his dream job, and I was managing a fun group of retail stores. After we'd been married a while, he started questioning and criticizing my career choice. I tried to ignore him, but ultimately, he became a bully. I went back for a graduate degree and changed careers so he could have a powerful asset as a wife. I did well in my career, but I hated it. I found myself resentful, and no matter what I did, the position I had, or the money I made, it was never enough for him. In time, I lost sight of any of my good qualities. When he couldn't bully me about my career, he switched to criticizing my body or how I interacted with our children. I took up sports that I resented intensely and developed a serious eating disorder, restricting calories severely or throwing up. We had 3 children, and that was how I found the motivation and strength to leave him and file for divorce. He became psychotic one night, pulled out a gun and held me hostage in our living room for 7 hours. I didn't know he was doing massive quantities of cocaine and was in cocaine psychosis. I left the next morning and took the children with me. I moved back to my hometown to be closer to family and friends. I didn't date for a while, but eventually through work, I was introduced to Dan. He was single, charming, good around my children, and secure in his career. We shared some common interests, and at the time, even though he lived a few hours away, it seemed like he might be the one. From time to time, he'd visit for the weekend, but we never lived together. His work required a lot of travel, and when I look back, there were red flags. But either I didn't recognize them or I simply chose to ignore them. For the kind of income he earned, he was always stretched thin. Several times after intimate moments, he offered to pay for implants. Later, it became clear he was jealous of my home and career success. I was climbing a ladder I didn't want, but I was doing it well. About 18 months in, he started withholding affection and any validation. Communication became sporadic and unpredictable. I noticed on weekends when my kids were at my parents' and we were together that he spent a lot of time online. I started to wonder, what was I doing wrong? Like my husband, he was pulling back, and somehow I felt like it was my fault. I would try to connect, try to gain his approval, but somehow the dynamic became even more strained. One day I came home from work and my son was waiting for me at the kitchen counter. Dan had been at our house earlier that day to drop off some things in my home office before he left on a trip. He'd left several browser windows open on my laptop, and what was there shocked me to my core. Emails revealed that he'd been spending time with no less than 10 to 15 different prostitutes in various cities every month. Payments were upwards of $600 a visit, and there were numerous explicit photos and disturbing communication. I was devastated. Everything had been a lie. I confronted him, and initially he was remorseful. He started outpatient treatment and attended 12-step meetings for recovering sex addicts. At the time, I felt as though I could cure him. When I caught him in more lies and affairs, I confronted him again one evening in my home, and that time he came after me. At 11 o'clock at night, I crawled out a second-story dormer window and ended up on the roof of my house screaming for help. My oldest son woke up, called 911, and Dan left, afraid of arrest. That's when I knew I needed professional help.
When Carol began working with us, it was clear that this was a case of complex PTSD. Trauma that starts at an early age and is compounded with more traumatic situations over a long period of time. From the perspective of self-view, there'd only been a brief window of happiness and positive experiences during her college years. While Carol did well in her career, she was exceptional as a mother. She'd lost a sense of her strengths and identity, and it was through her role as a parent that we were able to start the healing process. She was tasked with exploring how her children felt about her, and it brought forth both a humble joy and turning point. She had to acknowledge she was kind, nurturing, loving, and had a great sense of humor. She had to work on a lot of reframing and gridiron matches with Be-Itching Betty, but she did recover. The laws of physics teach us that everything is changing all of the time. Ocean waves crush coral into sand, mountain streams carve canyons across thousands of miles, and powerful winds blow seabirds to the plains of Wyoming. Friction and feelings of discomfort occur whenever we attempt to resist change.
For a moment, imagine yourself sitting on the side of a steep mountain, absolutely exhausted. You're halfway up the trail of life with the promise of happier times at the summit. Your backpack contains a massive boulder you've insisted carrying up the trail, and now it feels like it's crushing you. The boulder is your past, and you have a choice to make. You can continue to struggle, or you can choose to release the boulder. Visualize letting your boulder fall to the valley floor. Feel the tension in your neck, shoulders, and back slip away. Sometimes we may feel the need to find meaning in what happened to us before we're willing to explore and internalize the experience of compassion for ourselves and others. The process of developing self-compassion can help you move forward with purpose and gratitude. Self-compassion involves treating ourselves with the same kindness, understanding, and support that we would offer to a friend. It means recognizing that everyone makes mistakes and experiences difficulties, and that we are deserving of compassion and care just like anyone else. Practicing self-compassion can help manage stress, improve emotional resilience, and foster a more positive outlook on life. When we look below the surface of our communities, we can't help but recognize that suffering and, at times, feelings of personal inadequacy are part of the shared human experience. Something that we all go through, rather than something that happens to us alone. To find meaning in losses, we suggest that when participants are ready, they can seek opportunities to help others through similar challenges.
Forgiveness can be an important part of the healing process. Fundamental to forgiveness, the American Psychological Association describes this process as intentionally transforming deeply held negative feelings toward a form or mindset of grace, compassion, and benevolence. In brain studies of forgiveness, it's been found that forgiving activates structures and pathways in the brain that improve resilience, social connectivity, and motivation. In the body, forgiveness has been related to smiling, improved blood pressure, slower heartbeat, and lower risk of heart attack, reduction of pain, cholesterol levels, and sleep, calmer physiology such as increases in parasympathetic activity, and more relaxed facial muscles. Often repeated in session, we don't have to accept the unacceptable, we just stop taking any ownership, blame, or responsibility for other people's emotional dysregulation and bad behavior.
Most of us have felt intense emotional flooding that's so powerful we feel helpless and unable to contain the rage within our psyche. When it erupts, we're typically somewhere between wanting to scream at the top of our lungs or just wanting to be very, very alone. Episodes often occur in the context of relationships and cross-communication. Reframed as an opportunity, these situations can help surface the stuff of underlying triggers and fears.
The first step for addressing the frequency or intensity of full-blown episodes is finding 5 seconds. Let the surge of neurotransmitters, adrenaline, cortisol, and flooding happen without responding at all. If you've ever watched big wave surfing, you'll see that when things get out of control, surfers duck down beneath the surface and let the wave pass overhead with all its fury and explosiveness. We can visualize and practice the same thing. When we feel that overwhelming sense of panic, we can just let the powerful chemistry break in all its fury. Don't move. Imagine the crushing wave rush past you with all its power, explosiveness, and thunder. Don't try to stop it. You can't at this point. As the internal fury breaks, we find 5 seconds. First thing, think safety. Say to yourself, I'm safe right now. You may have to say that, or something like it a few times. Let the roar in your mind and the pounding in your heart recede. Don't move. Don't talk. Breathe. Wrap your arms closely across your chest and just hold on. Breathe. We're taking charge of our new life in these 5 seconds and those that follow. Trust yourself. Everything's okay, you're safe. Just breathe. Let the tension slip away. Feel the calmness slip in. Relax your shoulders. Breathe in deeply, exhale slowly.
It's easier to accept rather than fight the knowledge that from time to time we're going to experience intense and unpleasant emotions. Once clients learn to redirect their thoughts toward goal-oriented behavior and resilient positive self-talk, it's time to identify and practice self-soothing techniques in earnest.
Following on from finding 5 seconds, one time-honored approach is to deliberately slow down and breathe consciously and deeply a few times. When we do this, especially if we slow the exhale, this slows the heart rate and helps the fight or flight response diminish in intensity. Another technique is to practice the double breath method of inhaling, where we take a breath, then a second shorter breath before exhaling. Visual imagery is another powerful technique that helps with distress tolerance, stress reduction, and down-regulating cortisol and adrenal responses. We have participants think about a place they've been where they felt completely safe and at peace. This may be in the arms of someone who loves them, an actual place, or somewhere they may want to go. Some people visualize walking a trail, beachcombing for treasures, or sailing on a warm day, dolphins off the bow. An interesting discovery is that the heart rates of people engaging in imagined and actual activities are similar. Visual imagery of what we envision for ourselves long-term can help keep us motivated on those days where we just want to hibernate at home. Body scan meditation is another technique we teach that can alleviate tension. There are a lot of variations of the practice, both guided and self-guided, some sitting and some lying down. The goal is to develop deeper interoceptive awareness that supports stress reduction and the relief of somatic tension.
For some of us, identifying and implementing boundaries is a crucial skill for our mental health recovery. These are steps we can follow to establish and maintain these boundaries. First, we identify the feelings and needs associated with close relationships. Next, given this context, we identify what we need to feel safe in these situations. This self-awareness sets the foundation for creating personal boundaries. If fawning or conflict avoidance has been the default response, then we identify situations where it's safe for us to practice saying no. We evaluate which relationships are supportive and which provoke anxiety. If current conditions are toxic, then formulating a transition plan might become our primary goal. Some of us will need to find our authentic voice to overcome a legacy of disregarding or subjugating our own needs and desires. Practice writing and verbalizing I statements that support emotional and physical limits. Part of this process includes setting personal boundaries around shame, guilt, and blame. Recognizing that we may take on too much, we emphasize humorously that it might be time for us to stop shoulding all over ourselves and give ourselves permission to engage in self-care and activities that are nurturing and beneficial.
Being fully present takes discipline and deliberate awareness of inner thoughts and feelings. To start the day, we encourage practicing action thoughts like,
Just for today, let me accept myself and others as they are.
Or, let me live in today and celebrate. Or,
I'm not what happened to me. I'm kind, nurturing, focused, and simply working on things.
At the end of the day, reflection can help guide or adjust daily commitment or meditation practices. Critical to achieving peace of mind is becoming willing to appreciate unconditional acceptance for ourselves and others. To make the deliberate choice to let go of unpleasant, intrusive emotions that get in the way of enjoying the day and the company of others. When it comes to memories, the train the brain can be as simple as take the best, leave the rest.
We've covered some dysfunctional thought patterns, including biases and negative thinking that can lead to emotional overload, cravings, and relapse-driven eating. Mindful, goal-oriented thoughts can be one of our best tools to challenge the emotions that lead to relapse behaviors. In the past, some of us may have romanced relapse and even planned for it days ahead. These kinds of thoughts keep us mired in secretive guilt and old story, shame-based thinking that can keep us stuck. When we're stuck, we aren't enjoying ourselves, nor are we able to be fully authentic and present in life. When we give ourselves permission to be present and become willing to consider change as an opportunity, we live our life of potential. When we live this way, what we teach about ourselves brings out the best of us in ourselves and others. This state of acceptance and grace is rare, but a quality we're invariably drawn to in others. To practice being present, we become willing to shift from positions of judgment and condemnation toward unconditional appreciation of ourselves. We can love ourselves at the same time we're coaching ourselves toward new goals and behaviors. When we teach ourselves patience, we guard against letting bitching Betty criticize us for the normal mishaps or misspoken words that are part of everyday life. When we work from a strengths-based identity and connect humor with our eccentricities or preferences, we can find the peace of mind we've always wanted. We're home within ourselves. That doesn't mean we won't want to redecorate at times, but we can do it with deliberation, appreciation, and quiet determination.
Multitasking has been celebrated as a behavioral trait by human resource managers for the better part of 3 decades, but it's overrated. Multitasking robs us of the opportunity to do anything well and results in apprehension or, at times, frantic feelings of wondering when we're going to drop or forget one of the tasks that we're juggling. Humorously, from a safety and mindful perspective, it's helpful if our brain is connected to what our hands and the rest of our body is doing, especially if we happen to be driving. Not surprisingly, a British study found that, on average, multitasking reduces cognitive performance by the equivalent of 15 IQ points. Since IQ typically varies by about 3 points over a lifetime, that statistic represents a major degradation, one standard deviation, to our performance. It takes a while to become fully aware of the automatic thoughts and snippets of stuff that at times seem to randomly stream from our subconscious. Often these observations or thoughts aren't accompanied by emotions. They're simply a free-falling kaleidoscope of disorganized snippets of things we've seen or heard in the past, things that have nothing to do with what we're doing in the moment. This stream of stuff can make mastering the practice of meditation maddening or extremely frustrating. As children, we were masters of the moment. Relearning how to be present involves little more than scheduling 15 seconds 4 times a day. During the 15 seconds, appreciate what you see, what you hear, and what you smell. If you notice an emotional response, acknowledge and label it when you can. Over time, try to lengthen the time spent in quiet observation. If we're consistent in this practice, we retrain our brain to appreciate stillness. This stillness becomes peace of mind. When our brain learns that we function better with peace of mind, it will help us maintain this state. We're not taking on this healing work to be able to handle trauma, anxiety, pain, and depression. We're healing to be able to know joy and welcome happiness into our lives. Living in the present requires that we be willing to see what is in front of us just the way it is. To observe without judgment. This takes discipline and deliberate awareness of our inner thoughts and taking time to retrain Betty. To start the day, we can practice action thoughts like,
Just for today, let me accept myself and others as they are. Or, let me live in today and celebrate. Or, let me teach peace. Or,
I am not what happened to me.
I'm kind, nurturing, focused, and simply working on things.
At the end of the day, we can reflect on our progress and adjust our daily practices accordingly. Critical to achieving peace of mind is becoming willing to appreciate unconditional acceptance for ourselves and others. This does not mean we will forget what have happened to us. We make a deliberate choice and commit ourselves to process and let go of unpleasant emotions that keep us from enjoying today and the people we cherish. According to Adler, memories are expressions of our private logic and reflect our personal philosophy. He maintained that memories are never incidental or trivial. Rather, they are chosen reminders. We can choose to remember the best and leave the rest.
We all know people who seem like they're stuck in the past. They cannot, or are reluctant to, move beyond their past experiences and disappointment in relationships. Sometimes these individuals have all the qualities of a tragic Italian opera figure or martyr. It's frustrating and at times futile to be around them, yet we care and we want to help. What may be true is that their identity has actually fused with what happened in the past, and no amount of compliments or encouragement seems to make a difference. That said, many of us may have a tumultuous Act 1. By letting go of self-defeating beliefs, we have the opportunity to let the curtain fall on Act 1 and write Act 2.
The challenge is to keep the ghosts from the past in the past. We want to maintain our vigilance to ensure that they don't try to sneak under the curtain into Act 2 and ruin a promising outcome.
For the next 15 seconds, let your eyes rest on something in front of you. Observe the shape or textures, colors. Now listen to the sounds around you and take in any sense. Let them flow through your awareness and slip away. Breathe deeply and exhale slowly. Feel a sense of calmness enter the core of your being. Relax any tension you're feeling. Stop holding your breath. It's safe to relax and breathe. Imagine feeling centered or grounded all the time. What would it be like to be relaxed and present all the time? I can hear the resistance now.
But how would I get anything done?
But what about when I have to?
By now, we know that mindlessly carrying excess stress, projecting worst-case scenario, and other forms of needless anxiety is overrated. We can be present in our lives a majority of the time and remarkably will probably accomplish a lot more than we do now. It may seem simple, but make realistic lists and tell your brain, hey, relax up there. It's on the list, it'll get done at the right time.
From the beginning of this course, you've probably noticed that the illustrated story of Brian, Betty, the hippo, and self is unfolding with each chapter.
It's entirely possible to achieve harmony between the amygdala, hypothalamic pituitary axis, and hippocampus, and enjoy a newfound peace of mind that supports sustainable lifestyle changes. Imagine yourself holding Betty, Brian, and the hippo. We're teaching Betty, or our amygdala, that it's safe to love, safe to trust. That we cherish her spirit, that she's lovable, nurtured, and has the opportunity to be kind and loving. We're teaching the hippo that it's okay to focus on positive memories and enjoy new learning. We're teaching Brian that we can slow down and make lifestyle choices that help him work less to ensure balance and optimal functioning between our brain and body.
Congratulations, you made it through session 7. Take a minute or two to review the key points from this session, and then please take time for self-care and go do something fun.